In this video, I'd like to discuss aspects of radiotherapy to give you a basic understanding of what it's all about. This is because it's not particularly in the public domain what happens in radiotherapy, and you may well be somewhat frightened or particularly daunted at the prospect of having radiotherapy. But the whole key to radiotherapy is accuracy. In the modern world, the accuracy of radiotherapy is first class, and you can choose radiotherapy above surgery because the side effects of radiotherapy, thanks to its accuracy, are now much less than the side effects of surgery. So let's have a look at that. When you go into the treatment room, and you may have seen a treatment room in the past, you're confronted with a lot of very high technology equipment. And this is what's daunting about the process. What's all this equipment for? Well, the first piece of equipment and the main piece of equipment is this one here. This is the treatment machine. And the treatment is a high energy X-ray beam that comes out of this treatment head here and passes through your prostate gland, killing the cancer in your prostate gland. That's it. That is the treatment. All the rest of it is for the accuracy of the treatment, the word I mentioned on that first slide. And I want to go through that with you so you'll understand where this is all coming from. During the treatment, of course, you will lie on this couch. Your prostate gland will be at the exit of the X-ray machine, and the X-rays will pass through your prostate gland. And we see here a radiographer setting up a patient for treatment on the machine. And his head is generally down the treatment machine end of the couch, and the radiographer will move the couch under these controls so that his prostate gland is exactly where the X-rays come from this main treatment head. And you'll notice that the treatment machine is at an angle here, whereas it was vertical before. That's because in the modern era, and particularly in Edinburgh where I was treated, you are treated by a beam that is taken 360 degrees right around your body. Starts in the vertical, the beam is switched on, and then it traverses the 360 degrees, always pointing at your tumour. So the tumour is getting more and more and more and more radiation as the treatment machine circles, but the rest of the radiation that's going to bits of your body that we don't want to treat is being smeared out. And so your other organs and tissues are being treated far less by this process than by single beams alone. And let me just show you the geometry of that. You will be lying on a couch like this. Here's the treatment head, and the beam is coming out of the treatment head. This red cross is the most important point in the whole process. That's the point about which this treatment head rotates. When it's rotating, it's called the isocenter. And that's where your prostate gland and its tumor will have to be throughout the treatment procedure. Now, modern beam structure is really helpful in the accuracy stakes. When I was a young man, beams were either square or rectangular in shape because the jaws, as they're called, that the beam came out of, had straight edges. So the beam starts life up here at a target, comes out more or less as a circular beam, but it's shaped by these jaws here to being, in this case, a square beam. And that's the beam that would have treated you in the good old days. But now there's an extra set of jaws, if that's the way to put it. They're little fingers that can be put in and out to shape the beam to the exact shape of the tumour that it's going to strike. So these little fingers are shaped, and we now have the capability of treating an exact shape of tumour. That's new. Now that shaped beam is called conformal. It's a conformal beam. So if you hear that word in relation to your treatment, you are being treated by a modern machine. And a conformal beam, because it's shaped directly to the tumour, minimizes damage to non-tumour organs. That's the name of the game. That's what accuracy is all about. Here's one way in which accuracy can be assured. one of the ways, in fact, you will get if you're treated in Edinburgh, where I was treated. It's called Exact-Track. There are 2 X-ray machines located in the floor of the treatment room, each one pointing up to what looks like a computer monitor, actually, when you're lying on the couch. But these are detectors of X-ray beams. And so these 2 images are pumped out to the console, so the radiographer can see where 3 little gold seeds are that are placed in your tumor before the treatment starts. It's a very small procedure. It takes about 5 to 10 minutes under a little bit of local anesthetic, where these 3 gold seeds are inserted into your tumor. And they are seen by these 2 beams. And because these 2 beams cross each other, they see a slightly different shape for that triangle of gold seeds. And computer software can manipulate the couch position laterally and rotationally to exactly the place it was in when you were lying on the CT scanner having your plan made. So that's one. This is a very good accuracy device. Now let's have a look at the difference between between the old conventional treatment and what we get today, to see how it's improved. In the olden days, when we had square or rectangular beams, this little diagram here shows us 4 beams coming in at right angles to treat this strange shaped tumor here. But you'll see that they're treating this whole cube. This whole block is getting irradiated and therefore damaged by these high energy X-ray beams. And there's an awful lot more there than there is in the tumor. And that's shown over here on this little diagram of how things have improved over the years. Here's how it was when we were using conventional treatment. We didn't have the nice MRI scans that we have today, and so the tumor could not be delineated as perfectly as it is today. Therefore, the treatment gave quite a lot of extra size of beam to make sure that tumor was hit. And that extra size is about 1 centimeter, maybe half an inch. That's quite large. And so you're irradiating quite a lot of the human body in order to get that tumor. And the damage will be greater. But now, we now have these little fingers that can be shaped. So the beam comes through here at exactly the same shape as the tumor. And as the treatment head rotates, it changes the shape as it goes along. So it's always got the same shape as the tumor as it goes around the patient in 360 degrees. It's absolutely brilliant. And now we're in this position here, where that's the same size tumor as that was about 15, 20 years ago. But the margin around that's being treated, this is good tissue, is very, very small now, or about 2 millimeters. It's very tiny, because we now know where everything is. And I think one of the good things about radiotherapy is that the beam doesn't just cut off at the edge of the beam. It falls away slightly gradually, quite fast, but gradual. And that means that you'll be getting some irradiation in this blue area here, and a little tiny bit outside of it. And what that means is if you've got some very fragile pieces of tumor in that area that have grown outwards from the main tumor, but are not registering on the MRI scanner right now, they'll get knocked out as well. Now, this is not possible with surgery. The surgeon cuts at the edge of the prostate gland. Anything that's got out of the prostate gland is left in your body. So you do have to be careful, particularly if you're at stage 3 or stage 4 of the disease, where radiotherapy would be the ideal way to handle it. And let me now point out some of the other accuracy devices that are on the machine, because it looks quite busy when you go in there. These 2 devices here, which are usually folded in, when they're folded out, they are a built-in CT scanner. And so on your first treatment, as what happened to me, the very first pass of this beam going around you, the main beam is not on, but they're doing a CT scan to make absolutely certain you're in the same position as you were in when your plan was done on the CT scanner of the department. So there's another accuracy that's going in there. And finally down here, This is a transmission measurement device, which when it's folded out, as in this position here, it measures the amount of beam that goes through your body and comes out the other side. And that's yet a further check that the amount of deposition in your body is exactly what is expected, thereby making more accuracy for killing your tumor. Now, for this short video, I'd like to give credit to Varian Medical Systems, because the images that I used for linear accelerators, which is what the treatment machines are called, are Varian Medical Systems images from their website, and also to BrainLab, who are the manufacturers of the ExactTrack system. That's where the two beams cross at the tumor and see the gold seeds, and you can be accurately put into position. So finally, let me just go to an overview slide here, where we can see the treatment machine, which you will be on in the room, and here we see the radiographer at her console outside of the room, but she is always in control while you're in that room alone, and she sees an image of you, so if you get agitated or anything, she will know, and she could cut the beam, or indeed the beam would be cut if you move too far and those accuracy measuring devices told the beam to shut down. And if that happens, the radiographer will come back in, adjust your position to exactitude, go back out and continue with the treatment from where it left off. So there's a lot of built-in safety measures here. So please, my final message to you is go forward to your radiotherapy treatment with optimism and confidence. Millions of people have done it before you, and in fact, I've done it myself, and I can assure you it works. And my damage to my body is very, very limited indeed.